Hey guys, welcome back to another episode of Nursing Uncharted. I am really excited about this episode. I met my next guest, Taniqua, just a couple weeks ago, and we had a phenomenal conversation. So I am excited to get that out to the listeners and for them to learn a little bit more about you. So without further ado, please tell the listeners who you are and a little bit about yourself.
Hi guys, I'm Taniqua Mighty. I currently live in Houston and I've been a nurse for 9 years. I started in New York City. I was a pediatric nurse for 5 years, specializing in kids with multi-organ transplants. And then I decided to
Wow.
relocate to Florida, where I did telehealth nursing, just triaging patient messages during the day. And then at night, that's when I started my career as a travel nurse. During my time in Florida, I did travel nursing in New York, I did Connecticut, Houston, and then 1 year later, I decided to relocate to Houston again, where I ended up buying a house, and that's where I
Nice.
currently am and stayed for the past 3 years.
Oh,
Uh,
nice.
yes.
So you're originally from New York? I don't know if I didn't know that. I'm from Pennsylvania.
Oh,
So we
wow.
got the East Coast vibe.
Yes, yes, I just moved to Houston. Well, I keep saying just, it's been a few years, but I moved to
Yeah.
Houston in 2022, so
Oh, nice. And did you just, like, fall in love on your travel journey? Is
I
that what
did, because you know what
Yeah.
it is? I didn't know that Houston had the largest medical center in the world. I was like, "What?" Yeah.
Really?
It's like a
Oh,
bunch of hospitals that make up this huge medical center, yeah.
that's actually really cool. I didn't know that. My brother fun fact, my brother lives, in Texas. He lives outside of Dallas.
Yeah.
But I've never it was so funny, my Uber driver yesterday was like I said something about Texas and people always running red lights in Texas.
Yeah, awful drivers.
Yeah, and he was like, "Have you ever been to Houston? It's amazing." And I'm like, "No, I never did." So just ironic for these
It's such a
conversations.
huge you go down there and it's like, this hospital, that hospital, like many different hospitals that make up a huge
Oh,
campus, so
nice. Oh, that's amazing. I'll have to maybe in my travel journeys in the future, one will take me there.
yeah, we would love to have you.
The whole peds aspect, I know that that's something that when we first talked, that was, like, really special to you. But where remind me again, where are you working right now? What specialty?
So right now I'm doing med surg and it's neurosurgery. Yeah.
Neurosurgery. Oh, wow. Yeah.
Mhm. Yeah.
And then there's something that is coming up soon, right? That you're starting something new?
Yeah, this year, May, I finally graduated with my master's in nursing to be a family nurse practitioner. Yes.
Yay.
And my first job is coming up in like 2 weeks, and I'm gonna be specializing in outpatient cardiovascular surgery and wound care. So I'm really excited for that.
That's so exciting, and congratulations. I feel like a lot of the people I'm meeting, through doing this podcast, are advancing their degrees, and that's just something that, I think back to when I started my nursing career, and I'm like, maybe I'll do that one day, and then all of a sudden, it's like just what people are really going for. So, and it's a lot of hard work. So, congratulations. That's exciting.
Yeah, time went by so quickly. Like,
Yeah, yeah.
this September made 9 years for me, and I'm just like, "Wow," like, I still remember when I got my BSN, so
Yeah, I know, and it's so crazy how, like, people ask me all the time, "Well, how long have you been doing this?" And I have to, like, take a second and be like, "Oh, I don't wanna say that number out loud. I'm just aging myself."
yeah, after
And
10 years, I'm just gonna say a while.
yeah, it's been 10 plus years. Yeah, I think that's a good place to stop. And I think about, like, when I was a baby nurse, starting and someone's like, "I've been here 10 years." And I'm like, "10 years? I
Right?
can't imagine."
No, that was exactly me. No, for seriously.
Yeah. So something really that we like to hold true on this podcast is really highlighting what your passion is. So, what is something that's just like weighing on your heart or just like making you excited? Like what is that passion that you have about nursing?
My passion really is all things nursing, honestly, but recently I've been really focusing on all the changes that have occurred in nursing since I first started in 2016. Like, for example, even the shift, when I first started, it was predominantly women. Now there are so many male nurses. I'm like, "Wow, great. We love to have you. We need all the help we can get." And then also, just like when I first started, I met a lot of nurses that had been on the unit for 5+ years, or, it was just a lot of experienced nurses that I worked with. Now in 2025, I feel like it's a lot of newer nurses that I'm working with, or,
Yeah.
just like a lot of younger nurses, and also a lot of the newer nurses, they're staying on these units for like 1 year. Whereas when back then it was like everyone stayed for a while and got experience,
Yeah.
and they were I was taught that, you start nursing and you get your 2+ years experience and then you go back to school. Whereas these nurses, they graduate with their BSN. 1 year later, they're already enrolled in their master's degree programs, and, they're just
Yeah.
moving around a lot more than before. So,
Almost like you don't even need much at the bedside to get your
yeah.
advanced degree
No.
now, which is crazy
Yeah.
to think about because, I started this back in 2009 and things have just changed so much. And, and something with I remember is that the important thing about nursing is you have to be you have to adapt.
Yeah.
You have to adapt to these changes because medicine is ever changing. There's always going to be changes in medical treatments in whatever, but those changes are bigger than what I remember.
Yeah, no, no, honestly, just to piggyback off what you're saying, even the changes in the technologies that we use, like before, I guess, like some hospitals use like cows and stuff like that. Now,
Mhm.
I'm at a facility, we use iPhones to scan medications and scan
Yeah.
IV bars, like just even all the advancements in outside of like patient care that have has changed too. So yeah, you gotta
Yeah,
keep up.
and with the phones even, I remember we had before I started traveling, we had, like, a power outage, and it was a generator failure, and it was terrifying, and the lights went off, like, there were no lights, and they were like, "You're not allowed to have your cell phone has to stay in your locker." Well, no one listened, and thank goodness we didn't listen because we were able to have the flashlights on our phones.
Yeah.
So, and now it's like, "Oh, no, we use our phones." Like,
Yeah.
you use your phone to look things up. You have
Right.
your, like to look up medications. Hospitals give you the, you know, promo code, whatever, to download that app to be able to look things up. So it's like right there, at your fingertips. So I think it's fun. I think this will be fun
Yeah.
to like dive into this more and talk about those changes and like, highlight the pros, maybe some cons that we see. And like, I think it's a fun conversation to know that these changes are happening and what that's doing.
Yeah. No, no. Most of the changes I love, but yes, like you said, lots of pros and lots of cons.
Yeah. There's always gonna be cons and
Yeah.
everything, so, Yeah, and, like, just, like, a huge change, my very first job was paper charting.
Oh my god.
It was and we had, paper charts, and then the doctor would write in this, like, flip thing, and that's how we would get our orders, like, just, and now that's unheard of, and, like, people coming like, the new nurses coming out of nursing school, like, "What?" And I'm like, I'm not that old, so it wasn't that long ago.
No. No, and sometimes when the system is down, they'll tell us to do paper charting, and we're all just looking around like, "Wait, wait, where do we get that stuff
Yeah,
from?" Like, "What?"
we just don't chart during that hour of downtime, yeah.
Yeah. No, I'm like, "Okay, well, it's not gonna be that long, so I'll just wait." And
Back chart.
yeah, no, yeah,
Yeah.
so many changes, seriously.
Yeah.
Love it.
And I think a really interesting one is what you started with your passion is these advanced degrees
Yeah.
are faster. And like what does that look like and why? Like what is the why behind that?
I think after COVID, there just became such a huge need. There was always a need for nurses, but it just became such a huge need for nurses that
Mhm.
I almost think that they're making the requirement a lot easier. Just maybe they were thinking that it was too hard or it was deterring people from coming into the career
Yeah.
field, but now I feel like it's a lot easier to, become a nurse if you wanted to. Like, for example, when I first started to get into an accelerated program, you had to already have a degree. Like this had to be your second degree. But now a
Yeah.
lot of people online and that I'm speaking to, and when I did my research, there are programs out there where you can do an accelerated program without having a college degree already. And I was like, "Oh, wow, that's interesting." And then
Oh,
even
wow.
yeah, which is interesting. And then another thing I
Yeah.
saw is that, next year, possibly, the NCLEX will be a like, people will be able to take the NCLEX from home starting next year, which
That is
I
mind-blowing
know.
to me.
I'm like, I remember going to a secure location, being
Yes.
fingerprinted, the nervousness of having, like, proctors walking around and,
Yes.
to n now in 2026, possibly, being able to take that from home in the comfort of your own home.
Which is good because, I mean, I think there's good and bad with that. Like,
Yeah,
1, how is it monitored? Like,
yeah,
how do you prevent the, referring back to your notes?
right.
But also, like, the big thing is test anxiety,
Yeah,
and in nursing school, you get a little taste of that. I know a lot of programs, your clinical aspect is 2 exams. You have your midterm and your final,
right.
and then the clinical aspect is, like, pass fail,
Yeah,
and that's a lot of pressure. But to have to go into a room, feel like basically you're in trouble or like you're doing something wrong, and then take something that you've worked X amount of years for to potentially fail. And, like, I'll raise my hand. I failed the first time I took the NCLEX. I was so nervous.
right.
I stayed up all night cramming. Like, I took every single question and I was like, I failed. I know I did. And then when I took it again, I was like, this is so easy. But, like, how did
Yeah,
but it's the anxiety and that mind that, you're so afraid to fail because this is what you've worked so hard to do.
right.
And allowing the people that have that really strong test anxiety to maybe this be a more comfortable
Yeah.
way is a good thing.
Yeah, I look at it as a good thing too for those reasons, for people that have test taking anxiety. And then, but then I look at it like, okay, are they gonna make it harder? Because, like when you're in
Oh,
school, when it's like, oh, you can take the open book test where it's
open book test,
harder
yeah.
than like if we
Yeah.
didn't, or are they gonna make it, like if because I'm sure they're gonna have some type of system where someone's watching you and it's like, if I
Yeah.
fail too hard, am I gonna be disqualified?
Yeah,
You
oh
know what
my
I
gosh.
mean? So, but
Yeah.
we shall see.
I know. And maybe that it just made me think, like, I have my, RNC because I do neonatal ICU.
Yes.
So,
Mhm.
I got certified a couple years ago, and that is a really stressful test. I didn't even tell the guy I was dating at the time that I took the test or my parents. No one knew I was taking it because I didn't want that extra anxiety to be like, "Today's the day. You're gonna do great." Like, I just was like, "I'm gonna go. I'm not gonna tell anyone, and I'm gonna see, if I pass." But those questions, all of them were right, but you had to pick, like, the best one
Yeah,
or, like, the one that made the best. So maybe that, which I think would be harder, like the NCLEX exam in that aspect would be harder. So maybe that was a really good point to bring up.
I'm like, I'm wondering how they're gonna, because they make it so appealing, so it's like, okay, but what's the other part? All right, tell me what's the other
Yeah.
side.
Yeah, I know, I know.
What's the con, I guess.
Yeah, more to come on that, and maybe it'll make people still, like, wanting to go and do it in person because it might not be as
Yeah,
difficult. I don't know.
it would
We'll
be
have to
great
we'll
if
have
they
to see.
offered it both ways, actually.
Yeah,
Yeah, that's good to think about, yeah. Will it be offered still in person?
yeah. I mean, I don't even know which one I would choose, to be honest. I think
Right? So, we'll
yeah. And then another thing with, like, advancing the degrees sooner, but I think more nurses are traveling. That's something that I see because for me with my specialty, there's a lot of competition.
yeah,
Like and it's stressful because I never thought that I would be finding it difficult to find a job,
right.
you know,
No.
and then that has happened in the travel world. And I wonder if that's because of this huge influx of travel nurses.
Yeah, no. Yeah, definitely. I feel like after COVID, or not even after COVID, but during COVID,
Yeah.
travel nursing became so popular. It was a hot commodity. And, I myself started in 2021. I think what made travel nursing so popular outside of, you know, the financial aspect of it is that, it was more flexible. You saw a different hospital every few months, you were meeting new people,
Yeah.
you got to experience new cities, new places. You were learning a lot more because let's say you wanted to change specialties, but you didn't want to full turkey quit the unit you were on and you just wanted to see how it would be. So it just allowed for a
Yeah.
lot of, like, flexibility and opportunities, and it still does. And, contracts are still around even though, contrary to some people's beliefs that, "Oh my god, there's, like, no contract."
Yeah.
It's like, "No, they're still out." Yeah, travel nursing definitely took a huge, popularity turned during
Yeah.
times for sure.
And I've talked about that on this with, other people, like, even through AMN, like, recruiters and, like, what they're seeing, and, there's always, like, these, uh, up and down balancing of, what the travel industry is, and I think it's kind of remained pretty high from what I remember, like, from the conversation. But, like, something I mean, you said it in introducing yourself, you're in Houston now because you traveled and you fell in love with a new place.
Yeah.
Like, that's so cool. Like, not many people in your career path have that opportunity to do that.
No, exactly. And even with me traveling, I've inspired a lot of nurses that I started out with, like nurses that were like, "Oh, they're not leaving where they are," and they later on told
Yeah,
me like, "So how was travel nursing? Like I saw you, like it's worked out well for you," and I'm like, "Oh, yeah,
yeah,
it's working good." If you ever need any recommendations, AMN.
yeah. Yeah, call me, I'll get my referral. Yeah,
No,
yeah, yeah.
seriously. But yeah, definitely. I loved my time travel nursing. If I didn't, go back to school and get my graduate degree, I'm sure I'd still be doing it. I just actually stopped in December of last year. So I was doing travel nursing up until graduation, to be honest.
Yeah, and even where I'm in Southern California, and I'll run into nurses on travel assignments, even at the job that, I work at now, where they'll do a travel job in addition to their part-time job.
Yeah, that's what I was.
And just, like, get people to cover their shifts for them, use vacation time, and that just allows for a financial flexibility for families. I mean, Southern California is now known to be you can't afford to live here.
Expensive.
So, people are having to be creative, and it gives opportunities for people to get into a better financial situation, and I think, we always talk about, "Oh, travel nurses are paid so much," but, if you look at that from a positive side, sometimes it really helps people get back on their feet
Yeah,
that were maybe struggling or going through life changes that they're like, "What do I do?"
like,
And it allows for that opportunity.
and 100% true. So when I relocated to Florida and I started doing travel nursing, that's how I saved up the money to buy my house in Houston is I made
Yes,
from travel nursing.
which is
Love
amazing, like,
I
congratulations.
thank you so much. No, so absolutely true, 100%, and pay off debt and
Yeah,
whatever goal that is that you have, travel nursing allows that flexibility to do that. So,
it does, and I think, sorry, we're, like, getting off a little bit off tangent, but, like, to highlight the travel nursing, like, that is something that is always the stigma we don't wanna talk about is, like, our pay packages and our money, but, like, if you look at that and it just kinda came to me, like, during this conversation, it's like, if you look at that from, like, the benefit side of it and, like, juggling 2 jobs at once to get in a better spot, like, I think that that's a huge plus.
right.
It's not just, running after the most money, it's really just to, like, better yourself or get into a better situation, buy a house, have a great Christmas with your children, like, just things like that, I think are overlooked is a nice thing to highlight.
I know, now you guys have me thinking like, "Oh, wait, maybe I should
Can I do
do
these?
something on the side if I can." No, because all of the things you're saying is so true.
Yeah, and I think, it's funny because I'm a very open person. I'm open on this podcast, I'm open in my real life, and I talk about this, you know, people as a whole are struggling financially right now. I think
Oh,
it's just a really tough time in the world. In nursing, I feel like we have so much flexibility,
me too.
picking up overtime, getting a second job. A lot of nurses have a second job, either in healthcare or not in healthcare. And it's kind of crazy because we work so hard and we sacrifice so much of ourselves for others to then have another job on top of it is crazy. But everyone will hire a nurse.
I know, and
Like, if you think about that, like, an employer, they're like, "Oh, she's a nurse. Yeah, we'll hire her."
we need her. It's a
Yeah,
needed
yeah,
profession, like, and that's part of the reason why I went into nursing, because we're
yeah,
always needed no matter what, if the economy is doing good, bad, stable, nurses are always gonna be needed, so
yeah, and that is nice. You have stability. People are we talk about AI taking over, which is another change in healthcare,
yes,
but but you're gonna need that
still
person to
going to be
still deliver the decisions or whatever AI is bringing to the healthcare industry. You're still gonna need us.
yeah. that and nurses are one role that's not gonna be I don't think can fully
Yeah.
be replaced by AI. Yeah, definitely. Maybe they'll be able to help us with certain things, which will be great.
Yeah. Right, exactly.
But yeah, definitely.
Yeah, but, like, I mean, you think about that, like, even physicians, they can work from home. Like, you did telenursing,
Yeah,
but, like, there's not as many of those opportunities
yeah,
for, like, physicians or radiologists to work remote because they don't necessarily have to be there. I mean, to perform some of the, like, procedures, obviously, you have
yeah,
to be in person, but to make the medical decisions, look at our PCPs.
yeah.
Everything's telemed.
Right, exactly. There's a lot of options with apps and things like that for you to get healthcare online now. So, which a
Mhm.
lot of people are opting to because some people are just so busy, they don't have time to always
Yeah.
schedule, and for some reason, telehealth appointments are always like well, not always, I mean, but sometimes are a lot faster or easier to get than these
Oh, yeah.
in-person appointments. So people are opting for that a lot more now. That's another change in healthcare. So,
Yeah.
yeah.
Yeah, which, it's funny because we talk about changes, and I know in our first conversation, I was, like, kind of like, "Oh, the changes," and I'm like, "Oh my gosh, I'm turning into one of those old nurses that doesn't wanna change."
Yes,
But there are a lot of positives. Even with the things that may be a headache at first,
yeah.
you see the positive in that, and I think that's important for nurses to be adaptable to those changes.
Yes, 100% agreed. Yeah.
Yeah, and but I have to laugh because I didn't tell you this in our first our first meeting, but one of the changes you brought up was specialties wearing the same color scrubs,
Yes, yeah.
and when that happened in my hospital, we were so mad.
Really? Wow. Well, I can see that because sometimes
Yeah.
even when I'm at these hospitals, I'm like, "I just want a break. I wanna wear what I wanna wear." But that's why I'm happy at the facility I'm at now. We have to nurses wear a specific color, but on the weekends or on Fridays, they allow us to wear whatever color we want to wear. So that's great.
Oh, I like
Break. Me
that.
too, because sometimes it's like, these same scrubs, but yeah, no, that was
Yeah.
yeah, that's a definitely another change that I've seen is that a lot of facilities I've worked at, uh, depending on your specialty, decides the color scrubs you wear, like, let's say a facility says nurses wear blue, respiratory therapists wear, you know, like, burgundy or something like that.
Mhm.
Your nurses wear black or, and it helps the patients too recognize
Yeah.
who they're speaking to, so
And I think that's probably why whomever came up with that idea
yeah.
did it because I always go back to my parents, and, like, thankfully, my parents don't listen to every episode I do, because I do talk about them sometimes, but, like, I think about them and, they're getting older, and they're having to adapt to these changes, but are probably unaware of all the changes, and going into a hospital, they're lost.
Yeah,
Like, they don't know where to go, and even as a travel nurse, you walk into the hospital, you're lost.
yeah,
Like, you walk in and you immediately are lost.
right.
So,
No, seriously,
you know
you
yeah.
have to ask a lot
So,
of
like,
questions.
yeah, and, like, having obviously, they're not gonna, like there's not, like, a key outside like, at the main entrance that are like,
Yeah.
"This person wears this
Yeah,
color," but, as a patient, I would think, like, as the nurse, "Hey, if this person comes into the room and they're wearing gray," like, for us, the nurses were gray
yeah,
when I was at a facility that did this. It was like that I'm a nurse, so if I come in, please ask that other person, we'll be able to help you.
right,
But if they're wearing this color, they are environmental services
right.
or food services. And I think that helps the patients, their families, and loved ones, especially in the aging population.
Yeah, no, definitely, and even myself as a nurse, sometimes so many different specialties come in and out of the patient's room, and I'm just like,
Mhm.
"Wait, who's
Who are you?
that? Respiratory? Wait, is I needed to ask him a question," you know?
Yeah.
So the color coordination definitely helps in so many aspects. I do love it, but yeah.
Yeah, it's funny though, because I didn't tell you that I was, like, anti same scrub color
Like,
because
I can't wear my scrub top with SpongeBob on there, I'm joking, 'cause, back then,
Yeah,
the scrubs were, like, very
I know.
interesting, all these patterns that were on there, I was like, "Okay."
Like your Halloween one, your Christmas one, yeah. Like, yeah, it's so funny how, like, things
Have
scrubs have changed. I mean, let's talk about that, like, the colors and
the
they
fit.
fit you now.
Yeah, yeah, oh my god. Oh, goodness.
You're not wearing a bag.
They were, like, a lot like, very square and very like, 3 times your size, falling off, but now you
Yeah.
have the option of getting more fitted scrubs or and even different types of garments, vests, like sweaters, jackets type of thing. It doesn't have to be just be some
Yeah.
random, this is, like, specifically for nursing, you know? The
Yeah.
material is designed for us.
Yeah, and they breathe and they move with you. There's some stretch. I remember, like, going to, like, Walmart and buying my scrubs 'cause that like, back in the day, I'm from a small town,
Yeah.
that's the we didn't have scrub stores,
Right.
or you did, they were really expensive,
Yeah.
but you go and they were just horrible.
Oh my god, no.
And remember, that was not that long ago.
No, I know, it definitely wasn't, it was, like, yesterday.
Yesterday.
But yeah, yeah.
Yeah, and that's the thing, like, it's I think I said this, I wanted to wear I was a transport nurse, so I would have to wear a flight suit sometimes,
Oh, man, that's
and
so cool.
it was off they're they're flame resistant, like, fireproof, so they don't breathe at all,
Oh,
and it's blue, it's like a bag, they're made for men, so, like,
mhm.
the inseam is down to your knees, like, it was awful, like, you did not feel beautiful, feminine, you didn't feel anything in them except, like, you're wearing a bag,
Yeah,
so I went and got pink boots, flight boots to wear,
yeah.
and I wasn't allowed to wear 'em. I had to return 'em.
No.
They were too flashy, and now it's like, look,
Yeah.
my shoes are like fluorescent colors now,
Yeah,
and I get compliments, so
exactly.
it's funny.
And you know what too? I think that the changes with, like, the scrubs and things that we are able to wear in the hospital also helps our mood because sometimes it's like, "Oh, man, I really don't wanna be going into work on a Friday night," you know what I mean? But
Yeah,
at least I can look good, and sometimes that makes us feel good, you know what I mean? At
it
least we're
does.
starting off, even if the rest of the shift goes south, at least we're starting off with, like, such a positive, mindset and energy and things like that,
Yeah.
so, it's great.
And you're right, it does, and, people come in and, certain brands, we don't like to name brands, but, like, they'll have, like, these tops, and on some people, I'm just like, "That is so cute, I can't believe those are scrubs."
Yeah.
And it's nice, and, like, as women, we tend to compliment each other, and we care about those little things,
Yeah.
and it does, it sets your mood better, and we deal with some heavy stuff a lot, and, like, just those little changes that we've been able to
Yeah.
sneak in and now take over,
Right.
do affect our mood, and a happier nurse is better for a patient any day.
Exactly, right? No, seriously, and
Yeah.
I've gotten many compliments too from patients too on the scrubs
Mhm.
and, putting ourselves together and stuff like that and just looking fresh and new and clean,
Yeah.
that's great.
Yeah, I mean, I care more about that now than I ever did as a baby nurse, I'd roll in with my hair on top of my head, I'm wearing a bag, so what's it matter,
No, I get it. Oh my gosh.
Yeah. And then something I guess this kinda goes with the changes in healthcare, but you had brought this up, and I think it's important to talk about, is the realistic patient experience and expectations.
Yeah.
And you kinda brought up some things, so if you feel comfortable talking about that, I'd love to dive into that a little bit.
Yeah, just, I let patients know, like, the realistic expectation because there's a lot of things that are talked about online, especially, like, the thoughts that nursing is for the aesthetics and stuff like that, and it's just,
Yeah.
like, the hard work that we do, there's so much more behind how we as nurses spend our money online and stuff like that. There's a lot of things that go on in a hospital or any facility, medical facility that we can't highlight or show, but it's
Yeah.
a hard job, you know what I mean? Like, I know a lot of times patients come in and they think that they're gonna see their doctors the entire time throughout their stay, and it's like, "No, it's just me and you." And,
You're at home today.
what can I do for you? That realization is always so funny. This is not Grey's Anatomy where,
Yeah.
a lot of the, unrealistic expectations I think were set from there. But,
Yeah.
I just like to go over, like, things like that with patients and just let them know what to expect during their stays and just, you know, just be there for them
Yeah.
any way I can. So,
Yeah, and I think that it is, with me, it's different. I don't talk to my patient. I mean, I talk to them, they just don't talk back, but, I deal with the families, but the families aren't always there.
yeah.
So, I think back to, like, my brief stint in adult nursing and having to have, like, those not like it's like a stern talking to, but not really, but, like, setting those expectations, and that's something basics is, hi, I'm Anne. I'm your nurse today. I also have a few other patients down the hall.
Right.
I need to pass out all the meds for the day.
Yeah.
If you need me, please call, but I will be back to check on you. Like those basic,
Yeah.
expectations. But there's more to it. And you brought up something funny, like the TV being
Yes, I was
broken.
just about to say that when patients, they call and they're like, "Oh, the phone in the room's not working, or the TV's not working, or the light's not the bath." I'm like, "Okay, I went to nursing school. We didn't learn, like, maintenance and things like that, but I will get the proper person in here to help you." But the expectations on nurses are sometimes out of this world, and when something's not done, a lot of the times the nurses are who are called or
Yeah.
who are blamed,
Hmm.
unfortunately, but yeah, everything falls on the nurse, like, you didn't get
Yeah.
your food, that is the nurse's fault. I work night shift, so coming into work, you don't even understand how many times that's what the first thing I'm dealing with is, like, I still haven't gotten dinner, and
My dinner tray. Yeah.
the kitchen's closed. Like, it's not me. I would've brought you
Yeah.
food if I could walk down there, and 'cause the facility's huge, and get it, you know? I try to do the best I can, but trust me,
Yeah.
everything, I mean, as you know, Ann knows,
Yeah.
everything is a mess. Like, if something didn't take place, if, you know, if a certain specialty didn't do what they said that they were gonna do, it's somehow our fault. But
Yeah. And that hasn't changed.
no.
That's one of the constant things, and if anything, I think has gotten a little worse
Yeah.
of what falls on us. And I think too, like something just this just came in my mind is that before, not that we didn't use our brains, because I think we've always been critical thinkers and we've always tried to problem solve as nurses. That's what you're taught in school, and that's I think why most of us do what we do. But I think that even like the medical team, like the doctors, the mid-level providers, they're leaning on us a little bit too to be like, well, what did you see? Rather than just telling us what to do, they're now wanting our input more than ever. And I think that started with nurse-led rounding
Yeah.
and
We want
presenting. Go ahead.
ask this.
Yeah.
But saying, "Well, nurses, we need to be more involved in me and we wanna make decisions," and it's like, "Well, here you guys go, 2025, make the decision."
Yeah.
Or we definitely value your opinions at the least, definitely.
Mhm.
Many times I'm calling physicians, telling them what's going on with the patients, and they're definitely like, "Well, what do you think? What do you recommend?
Yeah.
What do you see normally?" And I'm just like, "No, but I."
But it's nice though, right? Like, I think that makes me feel like I'm a valued member of the team rather than just a task person.
Right,
Like, "Okay, you gave me a list. Done, 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 done." Like, we're actually. And I think that the patients rely on us for that too,
right.
to know our answers or to know the answers to their questions and to understand simple pathophysiology or how medications work. And, they're trusting us that the medication that we're giving them is what is supposed to be
Yeah.
and that we're looking it up and knowing that this medication can't be given with this one. Like there is a lot of responsibility that falls on us that, is a trusting relationship.
Definitely. I actually did a travel assignment in Connecticut where there was this physician that everyone knew, when you call this doctor, make sure you have suggestions and recommendations. He liked that because he wanted to know
Yeah.
that, we were thinking too. Like it wasn't just on him because contrary to whatever people may think, when you're caring for a patient, it's all of our patients. It's not just the doctors. It's not just mine. It's
Yeah.
everyone's that every team member that is involved with this patient's care. It's all of our responsibility. So yeah,
Yeah.
definitely think that's
Yeah.
great.
That's a positive, like, nurses matter.
Yeah.
Change, yeah.
Yeah.
I love that we had this conversation. I love that we kinda got off topic a little bit because we were able to really have, like, a genuine. I, like, sometimes forget I'm recording and I'm like, "Oh, wait, yeah, we're recording this,"
Oh, yeah?
and it's yeah, and it's just a genuine conversation about, you know,
Mm,
what we feel and what we experience and what it's like, and I love that. That's what I love about this podcast and this falling on my lap one day. I'm just grateful to meet people,
yeah.
have these conversations because I always say that travel nursing, you become a better nurse because you learn how to do things multiple different ways.
Seriously.
And and I'm learning so much from everyone that I'm meeting.
Yeah.
So like including you, like I had so many things spark in my brain during our conversation that I never really thought about before. And I think that that's special.
That's exactly how I felt talking to you, like, half the time, I'm like, "Oh my god, no, that's serious." Like, I feel like we're just having a conversation, and you
Yeah.
are definitely someone to learn so much from, you know? Learning the
Oh.
game from,
Yeah.
10 plus more years ago. I loved hearing your experiences and things like
Oh,
that.
thanks.
Thank you so much for
Thank you.
coming.
You're so sweet. Before we wrap this up, I always like to kind of close with some fun things and something I'm curious about, and you can answer this however you want, but how are you feeling about starting your first nurse practitioner job?
I feel like I have so many emotions. One is that I'm excited to leave bedside in the sense of like I've been doing this for 9 years and it's a change and I want to see
Mhm.
how that how I handle that and I'm excited that I'm now gonna have a different work schedule, so that's something that's gonna be interesting for me. I'm used to working 3
Yeah.
days a week, 12-hour shifts, where this is gonna be 8-hour shifts, 5 days a week, and I'll have my evenings and nights to sleep, like,
Yeah.
so many changes, and then also I'm going into cardiovascular, which is a different topic for me, so I'm interested in learning so much, just
Yeah.
everything, meeting new people. It's gonna be a different, like, hospital facility, so just very excited. And then also being
Yeah.
able to care for my patients on a provider level because,
That's so cool.
when you're a newer nurse, it's like, okay, you're not 100% sure what's going on, but after being in the field for so long, I'm already anticipating the things that the doctors are gonna order
Yeah.
or, what's gonna happen next and things like that. So it'll be great to, be able to care for my patients and from that provider role since
Yeah.
for the past few years, I feel like in my head, I've been like, "Okay, I know he's gonna do that. I know this is what's
Now,
happening."
can I just put the order in?
I
Like,
know.
sometimes that's where I'm like, "I
I
need an X-ray. Can I just come on.
Right.
Can I just put it in as, like, standard and then you co-sign me?"
Seriously.
Like, it's so funny.
Yeah.
So, yeah,
So I'm very
I'm really excited for you, and I think that I really enjoyed this conversation, so I'd love to circle back with you,
yeah.
maybe later on in the year and kinda talk about what that transition looks like. Because I think, you're right about to start and you're coming, you know, with, like, from the bedside nurse into that provider, and I think that would be a really cool conversation to have after you get your feet wet, after you
No,
form
I would
some
love
genuine
it.
opinions.
I wanna know too. I wonder if it's gonna be like, "Oh my god, I absolutely love it," or if it's gonna be like, "Oh my god, it's so much." I feel so bad for every provider I've ever talked about in my head. But no.
Given a hard time, yeah.
Yes.
Yeah, you're gonna definitely have a different perspective and, but it's always you can always rely on that nursing
Yeah.
degree, and I think that's so, so cool.
Yep, yep. I'll never forget being a nurse. Like, and I think that's so important. Like, even with like managers that I've had over the years, the ones that never forgot, like, like they were a nurse first, like the understanding
Yeah,
that they have, I think it totally shows in how they manage the unit, just like how for me, it's going to show in how I care for my patients because I was
right.
a nurse first. So I understand.
Yeah. Oh, I love that.
Mm.
What is to wrap this up, what is one piece of advice you could give general nursing, nurse practitioner, whatever you want? What is one thing?
I've thought about this. I think one of the most important things in 2025 is to get moving. Like, you know what I mean? Nothing grows in a comfort zone. So if you've been on this unit for 10 plus years, yeah, nothing grows in a comfort zone. So if you've been on this
I
unit
love
for
that.
10 plus years, just make a change. And now I'm not saying go quit your job and move to Kansas or something like that. I'm just
Yeah,
saying maybe join that new central line committee or, try to do that
love
charge
that.
nurse role or, you know, uh, do that research project, create those science billboard things. And you know what I mean?
Yes.
Compete, become a CN3, do what it takes. Like just do
Yeah,
something because that I feel like that also contributes to nurse burnout is like just doing the same thing for so many years.
over
You're
and over.
bored, you get
Yes.
tired, do something. Go back to school. Yeah, you know what I mean? Just make that move. Do that thing you were always scared to do because you might be good at it.
I love that is beautiful, and I feel
Mhm.
I can almost, like, hear it in my head, that being what we take. That is amazing, and nothing grows in a comfort zone. I'm never gonna forget that. So thank you for saying that.
Thank you. Thank you. Thank you. I appreciate it.
And thank you for coming on here. This has been great, and I know I'm gonna see you again.
Absolutely. It was nice meeting you.
Thank you for tuning in to Nursing Uncharted. You can learn more about this episode and our show on our website at amnhealthcare.com. If you enjoyed this episode, share it with a friend and subscribe to our show on your favorite podcast platform. You can also find show updates and nursing opportunities on our Instagram at AMN Nurse. Special thanks to AMN Healthcare for making this show possible.